This is part of a speaking session with 3 students, and I'm concentrating more on the delivery, the empathetic speech, the voice modulation, and the communication qualities of the students. I'm not bothered about how organized your speech is, whether you are answering to all questions, whether asking all the questions. I'm not bothered. I'm just trying to focus on your delivery rather than anything else. Okay, so I'll explain the scenario to you. It is a 41-year-old patient in the hospital. She just had her cesarean section, and then she's diagnosed with rheumatoid arthritis. So that means she has a lot of pain in her wrist and on her shoulders, and then she can't sleep because of the pain, and she is not willing to take medication for pain because she's afraid of, she fears that the child will be affected because she wants to breastfeed the child. So this is a scenario. So she keeps telling the nurse that I will not take the medication. I need to go home early. And I need to have some natural medication. These are the concerns of the patient. So you need to address the patient with a lot of empathy. So even when you insist on her taking the medication, you need to be very, very empathetic, very calm. Don't get angry. You understand me? So this is a scenario. Try to make her understand these medications are very important, why they are very useful. You can also suggest alternative medications, things that need not be taken internally. She doesn't need to introduce herself because she knows the patient already. She's in the ward. Okay, then she tells her, I understand that you are diagnosed with rheumatic arthritis, and you are in a lot of pain. You have pain in the wrist and on your shoulders. And I also understand that you cannot sleep in the night because of the pain. So how can I help you? That's how you start. So how do you introduce yourself? So I understand. How do you just try to say that? This is the thing. I understand that you have been diagnosed with rheumatic arthritis. You have been diagnosed with. So that is the grammar. You have been diagnosed with rheumatic arthritis, and then you are not able to sleep in the night because of the pain. I also understand that you have a lot of pain in the joints, and especially in the wrist and on the shoulder. Okay, so how can I help you? Then I say, oh, it's very painful. I cannot sleep in the night. It's very difficult. Then you say, oh, I understand that the doctor has prescribed some medications for you. Have you been taking them? Have you been taking them regularly? I understand. That is the grammar. I understand. I see, or I understand that. I see. You can write down if you want to, or you can just remember. I see that the doctor has prescribed some medications for you. Have you been taking them regularly? No. Have you been? The question is, have you been taking them regularly? You can also, are you taking them regularly? But the perfect grammar is, have you been taking them regularly? That is the perfect grammar. Okay. And again, the doctor prescribed and the doctor has prescribed. Which is correct? Has prescribed. I understand that the doctor has prescribed some medications for you. Have you been taking them regularly? Have you been taking them regularly? You start with, I understand that you have been diagnosed with rheumatoid arthritis, and you have a lot of pain in your wrist, your shoulders, and you have not been able to sleep properly in the night, is sometimes pronounced like F. You've been, or you can say you've been. It's better to say you've been. Okay? You've been diagnosed with rheumatic arthritis. I also understand, again, simple precedence. I also see, or I also understand that you had very little sleep last night because of the pain. So you're making the situation very empathetic. You understand me? Then you ask the question, have you been taking the medications? Okay, I understand. Again, I understand. I see that the doctor has prescribed some medications for you. Have you been taking them regularly? I understand some present. The doctor has prescribed some medications, present perfect tense. Have you been taking them? Again, present perfect tense. Who is going to start first? You can start first? Okay. Slowly. So I want you to pronounce and enunciate each word. Okay? Okay, you can start now.
I understand that you've been diagnosed with rheumatoid arthritis, and also I know you have severe pain and sleeping disturbance. The doctor has prescribed some medications for you. You've been taking regularly the medications?
No, you've been taking, so the question should start with have. Have you been taking them or the medication? Have you been taking the medications regularly? Can you raise your voice a little bit more?
Yeah. I understand that you...
See, I understand. So you need to pause there. Don't say, I understand that. You don't understand that. You understand that should be unstressed. You understand. I understand that you've been, you don't say full that. I understand that you've been diagnosed with rheumatoid arthritis. Yeah. Once again.
I understand that.
I understand.
I understand that.
Oh, see, little more. You speak to me. Oh, I understand. I understand that you've been diagnosed with rheumatoid arthritis. Yeah. You don't have to just speak. You just speak to me. Have some communication. Yeah.
I understand that you've been diagnosed with rheumatoid arthritis.
Okay.
And also I know you are...
And I also know.
Also I
Don't,
know.
you don't say, also I know. No. I also know. No. You speak as if, you don't say, I also know. I also know. See?
I also know you are suffering with severe pain and
You are suffering. You have.
you have.
Don't say you are having. Previously you said you are having. So you need to say you have. You can't say you are suffering from. It's very simple. In daily conversation, you don't say you are suffering. You say you have. I understand that you have some pain. You have severe pain. I understand that you have severe pain. And so you can't sleep in the night. Yeah. Okay.
I understand that.
I understand.
I understand.
See, learn to say that sentence without that coming in the first part. I understand. I know. I understand. I see. I understand that you also have a lot of pain. See that? Yeah.
I understand that you have severe pain and disturbed sleeping pattern due to your disease.
Okay.
And also I know the doctor has prescribed some medications for you.
See, I also understand that the doctor has prescribed some medications for you. See, there should be some communication. You're saying something, it is not touching my heart. You understand me? So then you don't have that communication. So you need to communicate rather than speak the sentence. It is not an answer. It is a two-way communication. So only when you create a rapport with the patient can the patient understand that the nurse looks at me with some consideration, speaks to me with some consideration? You understand me? Yeah, start.
I understand that. The doctor has
Again, I understand.
I-
See, you sit on the word I understand.
I understand.
See, I understand. I understand. Not I understand. എനിക്ക് മനസ്സിലാവുന്നത് I understand. I understand. I understand that you've been diagnosed with rheumatic arthritis. And you also have a lot of pain on your shoulders and in your wrist. And you can't sleep in the night. And have you been taking the medications? See, I'm just exaggerating a little bit for you to understand the tone of the language.
I understand that you've been diagnosed with rheumatoid arthritis.
Oh, wonderful.
And also I know you are having severe pain in your joints, wrists and on shoulders. Since the doctor has prescribed some medications for you, have you been taking them regularly?
The doctor has prescribed some medications for you. That's not the way. I understand the doctor has prescribed some medications for you. Have you been taking them regularly? See the question. Have you been taking them regularly? See, you have a doubt whether the patient takes the medication, so you say, have you been taking them regularly? See that? Start.
I understand that you've been diagnosed with rheumatoid arthritis, and also I know you are having severe pain in the joints, wrist and on the shoulders. The doctor has prescribed some medications for you. Have you been taking them regularly?
Yeah, there are two mistakes that you've made. One is you are having pain. You don't say you are having pain. That's a very common mistake with students. You say, I understand you have a lot of pain. You have a lot of pain, not you are having a lot of pain. Yeah. Just you understand English. See, the first thing is, I understand that you've been. I understand that you've been diagnosed with rheumatoid arthritis, and I see that you have a lot of pain in your joints and on your shoulder, and you did not have proper sleep last night due to the pain. Have you been taking them regularly? See the tone. The tone. Live in what you say. Get involved in what you speak. You get me? So I understand. Not I understand that you have been. See, that is you are answering a question. There is no feeling in your speech. There is no communication. So if you really want to improve your English, wherever you go, not only in your what you call in your OET speaking, in your real life situation, it's a life coaching, you understand me? You are able to communicate better. When you speak better, you transform your personality, isn't it so? What do you think? Yes or no? Yes. So this is how you get involved in your speech. Okay? Are you clear about what I say? You understand me? Let's try. It is not easy to transform your personality all of a sudden. Start again. Yeah.
I understand that you've been diagnosed with rheumatoid arthritis.
Yes.
And also I know you have severe pain on the shoulders, joints and the wrist. And a very little sleep on the last night. Is it so?
Yeah, that is true. I have a lot of pain and so I couldn't sleep last night. Yes.
The doctor has prescribed some medications for you.
Yes.
Have you been taking the medications properly?
Regularly.
Regularly?
Have you been taking? you have been taking. Have you been taking the medications regularly? What do you say? Have you been taking the medications regularly?
Have you been taking the medications regularly?
Much better, isn't it, so? Much better.